let's get into some topics. Let's talk about all things women's health. Let's talk about periods, pregnancy, cervixes. What is the plural for cervix? Who knows? No holds bar. No topic is off limits. And I'm going to give you guys some stories too, some personal accounts and also some stories that I've learned over the years. I've been an OB GYN since 2007, so I have a lot to share. I am Dr. Wendy, aka Dr. Dreverywoman. So why are PAPs now done every 3 to 5 years? Well, first, let's talk about what a PAP is. A PAP is cervical cancer screening. It is a swab or a brush that's used to collect cells from the cervix, and we examine those cells under a magnifying device, well, pathologist does, that determines if the cervical cells are demonstrating any signs of precancer or cancer. So it used to be that we would do those tests every year. Well, in 2009, after multiple studies, it was determined that we don't have to do them every year because cervical precancer cells move very slowly. So think about something like a mammogram. I usually recommend mammograms yearly because breast cancer cells can actually develop really quickly. Well, cervical cells don't do that. They develop extremely slowly. Think about something like a colonoscopy. Colonoscopies can be done anywhere from 5 to 10 years because colon cancer and precancer of the colon actually also moves really slowly. It doesn't go from 0 to cancer in a year. And in fact, cervical precancer cells from just slightly abnormal to cancer, it can take anywhere from 5 to 10 years. And so it was determined that we can actually do PAPs, especially for doing HPV testing. HPV is human papillomavirus. We can do those tests every 3 to 5 years. And we can still catch abnormalities before they're dangerous, before they're harmful to the person. So if a person has a normal PAP and they don't have a PAP the next year, and then they have a PAP with this, 2 or 3 years down the line, even if it's abnormal, it won't be cancer yet because everything moves so slowly. Now, what do I do when my patient wants to have a PAP every year? Well, in my experience, most insurance plans will cover a PAP every year if they're private insurance. Now, if they're Medicaid or if they are Medicare, a lot of times they won't cover the PAP every year. But in my experience, a lot of private insurance companies will cover a PAP every year. So it's okay for you, if you would like, to ask and see if you can get a PAP. But also know that if you have a PAP and then the next year that PAP is slightly abnormal, we will intervene. We will do a colposcopy. We will do further testing. But if we had waited the next year, it's very possible that that PAP would have gone back to normal because our bodies are able to regenerate, our bodies are able to renew themselves. And so it is very possible that in those 2 years, that slight abnormality would have fixed itself and we would not have had to do any further testing. So that's the downside to doing PAPs every year, is that we may intervene and we may do further investigation when maybe we didn't need to. But the upside is sometimes we do catch those anomalies. I like to do PAPs for my patients, usually every 2 years, because I have seen some stuff at 3 and 4 and 5 years that I'm like, oh, we could have probably done something a little sooner. So my PAP recommendation for my patients is to do a PAP every 2 years. But again, if a patient's like, well, let me wait 3 years, fine. I don't judge. If a PAP is abnormal, we should talk about that in another video. But if a PAP is abnormal, then it is reasonable to do something called a colposcopy. And if a colposcopy is abnormal, it's reasonable to do something called a lead. I will talk about colposcopy and lead in another video. I also want to discuss something I think is really near and dear to my heart, which is why some people don't get their PAPs. And it is often because the speculum. It's because of the speculum. The speculum, which is the device that's used to open the vagina, can be uncomfortable for people. I think that not every provider is trained very well to do a comfortable speculum exam. So, I think that's part of the problem. I also think that some clinics and offices may have just a one-size-fits-all approach where all the speculums are the same size, and it's not always the best thing for every person. So if you're somebody who's had pain in the past with PAPs or with speculum exams, it'd be reasonable to see, can they use a smaller speculum? Or is there any opportunity to do any kind of stretching or physical therapy on your own even before you get to the gynecologist? But the other thing that you need to make sure you don't do, these are some don't do's for your PAP. Try not to clench, okay? I don't tell people to relax because the last thing a person wants to hear if they're not relaxed is for somebody to tell them to relax. So what I tell people is take a deep breath, bring their bottom down to the edge of the table, like as low as they can, and breathe, because that will help the person to inadvertently relax their body and to help to let those pelvic muscles stretch. If you check out another video I have, it'll show you that these vaginas come in various shapes and sizes, and it is really important for you to know that there's space in there. It's just a matter of us being able to carefully find your cervix and not open the speculum too much and not have a speculum that's too large. And also stay tuned and look out for that video about the vagina sizes. But that's all for now. I want to keep these short and sweet. So more to come, but thank you for rocking with me. And don't forget to subscribe and tell a friend and to go see your friendly local gynecologist.